Nurses are walking away because they are stressed out and fed up.
David Menzies for Rebel News here in Toronto. Well, folks, the other day we ventured down to the TV Ontario studio. That was the venue for the Ontario Leaders Debate. And outside there were a couple of protests. One of them was comprised of nurses, and their complaint was twofold. A, they've only received a 1% salary increase during COVID. And secondly, that the stress level working in hospitals and other healthcare institutions is off the charts. Now, here's the thing. When I looked at asking the nurse I was interviewing about the root causes of the stress, namely that hundreds of nurses have been laid off without salary or benefits, and maybe that is adding to the workload, that is adding to the stress. Check out what another nurse had to say. Suddenly, when it came to vaccination, it was none of my bloody business. Check it out. What is the reason why it's anybody but Doug?
Because he's just broken a lot of promises, every promise. And he capped our wages at 1%. We're a female-dominant profession, obviously, and I think that's why he did it.
Ma'am, what would make you happy in terms of what this Doug Ford government could do in terms of a wage increase or anything else?
He needs to really look at the wages. He needs to acknowledge what we do. I don't think a lot of people have a clue what the RPNs do. In comparison to the RN role or the PSW role. We do everything. We do the care. We have the hands-on care. I've worked in the long-term care setting as well, and I left because it is way too much there as well. There's too much of a burden on the nurses. You're working for free, sometimes for an hour and a half.
Wow.
Because you have a license, you can't leave. I think he really understands any of that, which is a lack of respect. If you want to put a cap on our wages, before you do that, you need to understand what we do, and then tell us why you don't think we deserve a decent wage.
I'm just wondering, we keep hearing how overworked people in the medical profession are because of COVID. What's your opinion of those nurses who were suspended without pay for not getting the COVID jab?
Yeah.
We're done? Oh, why are we done here? I wasn't even talking to you, sir.
We're good. Thank you, though.
Okay, then. But do you have an opinion on that? I mean, if these nurses were on the floor, wouldn't there be less stress?
I think there's reasons why there's a lot of nurses that, for medical reasons, couldn't get the vaccine.
Right.
And I don't think they should have been terminated. Okay? He was not allowing any exemptions to be accepted. So I think it depends on the circumstance. But that's not what our shortages are for. Nurses are walking away because they are stressed out and fed up.
Hey folks, Rebel News will be closely covering the Ontario election campaign, and as we crisscross the province trying to scrum the leaders and looking for other stories, well, we do incur some expenses. If you can kindly go to realreporters.ca, that's realreporters.ca, and make a donation, that would be greatly appreciated.